Welcome to the segment on going home with a pacemaker or an implantable cardiodefibrillator, ICD. In this segment, you'll learn how to care for yourself and gradually increase your activity after the procedure. You'll learn what to expect from life with a pacemaker or ICD and what you'll need to do long-term to take care of yourself and the device. When you go home, take care of your incision by keeping it clean and dry. Don't bathe during the first week and cover the incision if you shower. For the first few days, keep your arm still and don't raise it above your shoulder. You might need to wear a sling. Your collarbone area will probably be sore for a few days. For about 2 to 4 weeks, you can also expect some minor swelling of the pocket where the device was inserted. For 6 to 8 weeks, be careful with physical activity. For example, your doctor may tell you not to lift objects, drive, or do activities that involve raising your arms or could bump the pacemaker. Also, pay attention to your body. Call your doctor if you notice any signs of infection or symptoms that mean the pacemaker might not be working correctly. Call your doctor if you notice redness, swelling, or drainage around the wound, if you have a fever over 101 degrees Fahrenheit, if you have joint pain, stiffness, or weakness in your arm, if you feel faint, feel dizzy, or constantly feel tired, if you have a very fast or slow heartbeat, swelling hands or ankles, or hiccups that don't go away. Also call if you have twitching muscles in your chest or abdomen, chest pain, or a kicking sensation in your chest. After your initial recovery, a pacemaker or ICD will create some changes in your life. As you know, a pacemaker or ICD helps your heartbeat at a steady pace. If your heartbeat becomes too fast or goes into an unstable rhythm, an ICD will send a shock to your heart to reset it to a normal rhythm. This shock can be somewhat painful, but it's intended to save your life. If you do have one of these strong shocks, call your doctor as soon as you can. Also call your doctor if you have chest pain or other heart symptoms. They may mean the device needs to be adjusted. Always carry your device ID card. It gives healthcare providers important information in an emergency, and let your regular healthcare providers know you have a pacemaker or ICD. Don't let anything hit or rub the part of your chest where the device is implanted. This means avoiding contact sports or sports such as tennis or baseball. Avoid strong electromagnetic fields. What do we mean by that? Here are some examples. Stay away from high-intensity power lines. Tell your dentist's office about your device so they can avoid using an ultrasonic cleaner when your teeth are cleaned. In a hospital or clinic, stay away from the MRI machine. Engines can create a strong field, so don't lean over the hood of a running car. An old, poorly shielded microwave may interfere with your device, but most newer models are fine. Finally, be careful with cell phones and MP3 players. If your phone or player is on, don't carry it in a pocket over the pacemaker or ICD. When you're using your cell phone, hold it to the opposite ear. Now here are some things you don't have to worry about. Airport screening devices won't hurt your device. You may set off an alarm, but if you do, just show your device ID. Small household appliances or computers are also generally safe. Your doctor will ask you to set up periodic follow-up appointments to check your ICD or pacemaker. Your doctor will test how it's working and might adjust its settings. Your doctor might even be able to check your device remotely using a transmitter and your phone. As for the battery, it usually lasts around 5 years. During follow-up appointments, your doctor will check to see if the battery needs to be replaced. In rare cases, the leads between your heart and the device can become cracked. If this happens, you will have a procedure to replace them. This is the end of the segment on life with a pacemaker or ICD. If any of these instructions are different from what you've been told by your healthcare providers, you should follow their advice. Take good care of yourself, your device, and your heart.